I had a transplant in March of 2017. Before that, I was diagnosed with bile duct cancer, a really rare form of cancer, and really my only chance for survival was a liver transplant.
On the pre-transplant side, the first time that the patient meets anybody is me. And so I have to have all of that clinical knowledge and have their diagnosis, their background, their treatment, their plan, and educate them on the whole transplant process. We do a ton of education on the pre-transplant side to alleviate their concerns. So they meet with a multidisciplinary team. So it's not just the coordinator, it's dietary and pharmacy and finance and social work. So they have this huge team that they get to meet with.
Being part of that huge team, I think, is an honor. I mean, we come into these patients' lives at a very overwhelming and kind of vulnerable state for them.
It was pretty rough. I was getting to the point where it was life was not too fun, and actually was in the hospital when I got the call that there was a potential organ for me. And so within a matter of hours, I learned that it was my organ. My donor had come along, sadly for that family, but for me it meant life.
The transplant coordinator role is very, very important. They're the quarterback to arrange all those procedures from multiple specialty. You could, from social worker standpoint, nutrition, medical treatment, all those things. Those are being arranged. So in short, they have to have a lot of critical thinking and at the same time multitasking. It's probably easier to be a transplant surgeon than a transplant coordinator.
The biggest thing on the post side is making sure that they know what they should call us with. Certain things that they could have, certain symptoms can be rejection, infection, could be as simple as a medication side effect, but we don't want them at home trying to figure that out. Let us do the stressing, let us try to take that burden and figure it out.
I have something new inside of me, and I think the support and the idea that I have to take good care of myself is new. Most of us do take care of ourselves, but not to this extent. And I kind of feel like, hey, if something's not right, I have somebody I can call immediately, and they will pay attention to me. So that whole, they are just part of my fabric, so to speak. And if I scrape my finger, I could probably even call them as well.
It's really neat to see them come back like 3 months down the road, 6 months, a year even, and say, wow, you were right, we got to that point, or a couple years down the road where I have patients coming back saying they don't even remember that they had a transplant most days.
It's the patients, it's seeing them learn, it's seeing them grow, the families as well. Obviously you want them to get transplanted, but even if they don't, the connections that you make, I'm just humbled to be part of their life.
They also, tell me, enjoy life. I mean, really, a person who was going to die and is not in that situation anymore can say, I need to go do these things. I mean, why not? Why stop?